You've probably heard about the new generation of weight loss drugs. They're being called nothing short of revolutionary. But for the millions of people on them, there's this huge question hanging in the air. What actually happens when you stop? So maybe you're on Ozempic, or Wegovy, or Mounjaro, and you're starting to think about what's next. It could be because of the cost, maybe the side effects, or you're planning a family, or hey, you've just hit your goal weight. Whatever the reason, the decision to stop is a big one. So let's really get into the science and see what the evidence says happens to your body once that medication isn't there anymore.
All right, first up, the GLP-1 revolution. To really get what happens when you stop, we've got to first understand why these drugs are such a massive deal in the first place.
Okay, so these drugs belong to a class called GLP-1 receptor agonists. Now, what does that even mean? Well, basically, they work by copying a hormone our gut naturally makes that controls our appetite and blood sugar. The results are incredible. We're talking people losing 15 to 20% of their body weight. But here's the absolute key. They were designed for long-term use. The key thing to get here is that they are not a quick fix. Think of them less like an antibiotic you take for a week and more like medicine you'd take for high blood pressure, something you need continuously to manage an ongoing chronic condition like obesity.
Okay, section 2, your body on the drug. Let's look under the hood. What are these drugs actually doing inside your body that's so darn effective? It's really this powerful 1-2-3 punch. First, the drug slows down your digestion, so food just sits in your stomach longer, making you feel fuller for longer. Second, it goes to work right on your brain's appetite center, dialing down hunger signals. A lot of people on these drugs talk about this. They say it finally quiets the food noise in their head. That constant chatter about what to eat next, gone. And third, it helps keep your blood sugar in check. It's this combination that leads to a huge drop in calorie intake and some really significant weight loss.
And the results? They are absolutely staggering. I mean, look at this. The big, famous Step 1 clinical trial for Semaglutide, which is the drug in Ozempic and Wegovy, showed people lost an average of 17.3% of their body weight. And that's not just a number on a scale. That is a massive biological change for a person's body.
All right, section 3, the reversal. This is the heart of what we're talking about today. We know the drugs work wonders while you're on them, but what does the science say happens the moment you stop taking them?
2/3. If there is one number you take away from this entire explainer, it's this one. The data from study after study is crystal clear. Within just 1 year of stopping, people regain, on average, 2/3 of the weight they worked so hard to lose. And let me be clear, this isn't a maybe or a what if, it's a documented physiological fact.
This chart really paints the picture, doesn't it? This is data from that same Step 1 trial. You see that amazing initial drop, all the way down 17.3%. But then, look what happens in the year after people stopped the drug. That line just shoots right back up. They gained back almost 12%, leaving them with a net loss of just over 5%. It just goes to show, without the drug, most of that progress, it just evaporates.
And the weight regain? That's just what you see on the outside. Underneath, it's a total system reboot back to your old settings. Your appetite, it comes back. And a lot of people say it comes back with a vengeance, sometimes in the very first week. That food noise we talked about, it's not quiet anymore, it's back at full volume. And it's not just about hunger. Those great health benefits, they start to reverse too. Blood pressure, it creeps back up. Cholesterol, same story. And blood sugar control, yeah, that starts to slip as well.
So that leads us to section 4, why the weight returns. And I cannot stress this enough. This rebound effect has nothing to do with a lack of willpower. It is pure biology. So let's dig into the why.
The big idea here is something called the body's set point theory. Think of it like a thermostat for your weight. Your body has a weight range it's comfortable with, and it will fight tooth and nail to defend it. So when you lose a lot of weight, your body kind of freaks out. It thinks there's a famine happening. So it hits the emergency brakes. Your metabolism slows down to save energy, and your brain pumps out hunger hormones to get you to eat. The GLP-1 drug basically puts a muzzle on that whole defense system. But once you take the drug away, that system roars back to life.
And here's something that's really, really important to understand. It's not just that the weight comes back, it's how it comes back. See, when you're losing weight on the drug, you lose mostly fat, but you also lose some muscle. That's just unavoidable. But when you regain the weight, it comes back almost entirely as fat. And that's a big problem because muscle burns more calories than fat. So you end up with a higher body fat percentage and a slower metabolism than before, which makes it even tougher to manage your weight going forward. This really gets to the heart of how doctors are starting to talk about this. They use this great analogy. Stopping these drugs is like stopping blood pressure medication. You wouldn't stop taking your blood pressure pills and expect your blood pressure to stay low, right? It's the same idea. It forces us to see obesity not as a simple problem to be cured, but as a chronic disease that needs ongoing, continuous management.
Okay, section 5, managing the path forward. Now, I know a lot of this might sound a little discouraging, but knowledge is power. Knowing this is what happens means you can prepare for it. So what can you actually do to fight back against this rebound if you have to stop?
First things first, and this is non-negotiable. Talk to your doctor. Don't just stop on your own. Beyond that, the smartest strategy is to use your time on the medication as a training ground. Think about it. Your appetite is low, the food noise is gone. This is the perfect window to build rock-solid lifelong habits. We're talking serious exercise. The recommendation is over 300 minutes a week, with a real focus on strength training to hang on to that precious muscle. It means locking in a nutrient-dense diet, and it means getting your sleep and stress under control, because those things have a huge effect on your hormones.
There's also another strategy that's getting a lot of attention: tapering. So instead of stopping cold turkey, you and your doctor would create a plan to slowly lower your dose over several weeks or even months. There's some early research showing this can help stabilize weight after stopping. Now, we definitely need more studies, but the thinking is that it gives your body a chance to adjust, to kind of ease off the drug instead of having the rug pulled out from under it. It's a really important conversation to have with your provider.
And really, that brings us to the final and maybe the most important question of all. Are we really talking about stopping a drug, which sounds so final, or should we be thinking of it as pausing a treatment for a chronic disease? That one little change in how we frame it, it changes everything. It reframes this entire journey not as a short-term fix, but as a long-term plan for managing your health. Thanks for joining me for this explainer.